Okay, it looks like I think everybody is in.
All right, are we ready to start? Or are we waiting for a few more people?
I think that everyone is in.
Okay. All right. Well, welcome everybody to the July Community Engagement and Communications meeting. We're gonna do a quick tech check, roll call, and agenda review. So if staff want to lead us through that. I think we do not have a Spanish interpreter today.
That's correct. Would you like me to?
Yeah, I don't know if you want to lead this part.
Sure. Yeah. So those are the guidelines for navigating Zoom. If you have any issues, probably the easiest thing to do is raise your hand, and we can try and address that. Yeah, I think no interpretation today, as Amy mentioned.
Great. So next we have a roll call.
Yes, I will do that. Michelle Glass.
Here.
Amy Fellows.
Here.
Grace Hockhog. And again, if I mispronounce anyone's name, please correct me. I didn't see Grace today. Mickey Dirting.
I'm here.
Thank you. Juan Pablo Villalobos Garcia. Let me know that he's unavailable today. Colin Stackhouse.
Here.
Max Brown, let me know that he's unavailable today. Jensina Hawkins.
I'm here.
Thank you. Jay Brown. I didn't see them in the list. John Buzzard.
Here.
Thank you. Craig Newton.
Here. Hello, everyone.
Thank you. Juana Jensina Hernandez Solis.
I'm here.
Thank you. And Jocelyn Ogden.
Here.
Thank you.
Great. If we want to move to the agenda review, thank you. So yeah, we're going to go over committee and board updates with our executive director, Mimi McDonald, sorry. And then we'll be going over a draft communications plan that our consultant Patty Wentz has put together. She was unavailable to walk us through it today, so we're gonna just kind of briefly go through it, and then we can bring questions, concerns, comments back to her when we meet with her next week. An update on the style guide, any committee member updates that you all have from work that you are doing in the community related to this, and meeting reflections, future topics, and then ending with public comment. So Mimi.
Thank you. Hi, everyone. If I haven't met you yet, I'm Mimi McDonald, the Executive Director of the Universal Health Plan Governance Board. And first off, I would like to introduce to everyone here Lee Hastings, who is our new Senior Policy Advisor, and which we are delighted to have Lee join us. We, of course, miss Kim Yee, as I know you all have had the opportunity to work with Kim, but Lee is an incredible asset. So Lee, I'll give you the chance to say hello, so your face will pop up and people can see you.
Hello, everyone. Happy to be here. And yeah, those of you that were at the board meeting met me, but I've been in healthcare policy for about 15 years, predominantly in value-based care.
All right. So just to give a brief update, kind of what's happening at the board and also at the other committees. So things at our last board meeting, which was last week, I think, the board is working on is revising the mission statement that they had started, and then that will then come to the CECC for further revision and sort of plain language oversight and everything that this committee does. Other topics at the board was kind of discussing ideas around financial risk bearing, and if that's something that would only happen at the state level, or if as you may know, then a lot of payment models, there can be risk bearing even at the provider level or at a hospital level or at a regional level. So that was some of the discussion. Then again, the discussion around excuse me, around what would the function of regional entities be within this universal health plan. Would they be advisory only? Could they be administrative? So I wish I could say that we all have answers to those questions. We don't, but those are the topics that the board is wrestling with, and we'll keep working on it. And of course, everyone's input is always encouraged. Next, plan design and expenditure. They have been doing a lot of work on provider payments. And there was a subcommittee that has done a substantial amount of work. Really, plan design is focusing first on primary care provider payments, behavioral health care payments, and then we'll branch out a little bit more into specialty care, and then also kind of the inpatient hospital care coverage. So that's where they are with that. The hope is at the next plan design and expenditure meeting that they will be able to come up with some proposals to bring to the board, at least around recommendations for primary care payment types. Also just beginning the work on quality issues and how that can be, the hope is that that can be simplified and unified across the state. And our latest consultant group to join us is Milliman, which is a national organization, is going to start providing some of the cost estimates of what has come from the plan design committee. So in other words, all right, if we are able to provide this level of service to this many Oregonians or people living in Oregon, what will the costs be? Next, finance and revenue is working very closely with our Echo Northwest consultants on reviewing and creating a plan, a revenue plan, by sort of utilizing current revenue streams that are available. So for example, a personal income tax or perhaps a payroll tax, and sort of manipulating those in different ways through looking at it through a lens of equity, a lens of sort of a progressive type of tax. And we'll be coming up with some recommendations too with that. And then lastly, operations. They're working on the development of what a trust fund would look like with the Universal Health Plan. Have operations has now just started on startup costs, which they have taken over from the Finance and Revenue Committee. And again, the Milliman consultant group onboarding will be a big assist to the work of the operations and plan design and expenditure. So that's what I have for you. Thank you. Oh, any questions if anyone has any? Sorry. Okay, I don't see any hands, so I'll turn it back to you, Amy.
Great. Yeah. So next we're going to look at the draft communication plan that Michelle and I worked with Patty on some, and it's still very much draft. I'm not sure, do you have to switch screens, Isabel? Or is it in this slideshow? Okay. Okay. Yep. We're ready. Great. I'm going to just maybe give us a couple minutes because I don't know if people had a chance to review this prior to the meeting. So maybe if we just take a couple minutes, this is the screen with like the most text on it, just to give the context, and then we'll move on to the others in a couple minutes here.
Can I just add real quick, Amy, before we dive into it, that this is the first step of our contract with Patty Wentz, as Amy mentioned. And so this likely isn't all new information. This is just kind of summarizing what has already been in our communications work stream. But the consultant has basically taken all of that, the work stream information, kind of what was on our deliverables list for developing communications resources, as well as other guidance that you all have given since we've started meeting, and written it into a plan that says what we're going to do, when we're going to do it. So that's, I just want to kind of set expectations that this is probably familiar. It's just in a new format, and it's kind of our consultant checking with us and saying, this is what I understand you want us to do. Is that correct? So we'd love to hear any and all feedback, but especially anything that you think doesn't align with your understanding of what we've been discussing over the last few months about this communications piece of work. So just wanted to level set a little bit. Thanks.
Thank you. That was helpful, Michelle. Do people need a couple more minutes? Maybe as you're ready to move on, if people can do a thumbs up. Are people ready to move to the next? 2 thumbs up, 3.
Hey, Amy,
Yes, yes.
this is Jensina, and I actually don't see the option to raise my hand, but
Oh,
can,
I think it's under the react, the heart.
is it? Because it just says play the chime for raised hands or recognize hand gestures.
Oh, okay.
But
Interesting.
at least that's what it says on my screen. Can you please refresh for me who is the target audience for this particular document?
It's
the reason
on the
I'm
next, it's on,
okay.
yeah, sorry. Yeah, go ahead and finish your sentence.
Oh, the reason I'm asking is because it's really wordy.
I think what the plan talks about in terms of target audience is the target audience for our communications. The target audience for this document is just us and the board. This is an internal document. It's not public facing necessarily. I mean, everything we do is transparent to the public, but
Sure.
this is really just for us to make sure that we are on the same page as our contractor, and so that the board understands the work that we're doing and when pieces of that work are going to come to them.
Okay, thank you.
Yeah, and I think if we're okay to move to the next screen, it addresses the audience in terms of the communication work that this covers, those audiences that the various tools are directed towards. So the primary audiences, again, are the ones that are in our scope of work, which is detailed by Senate Bill 1089. And then other audiences are the state lawmakers, as we have to have a plan to give to them in September 2026. And the media who may be following this and may be more and more getting engaged given what is happening, you know, federally, and as they pay more attention to the work that we all are doing. So these 1 through 6 are kind of what is spelled out in our statement of work with our consultant, Patty Wentz, and the tools to be developed that we'll be engaging with her and with you all as they are developed, and then we will bring them back here bring them to the board and so on to have a feedback loop. So a strategic message guide, one pager, FAQs, which we, some of these things, like Michelle said, we've been talking about, but we now have somebody to support us moving the work forward. A PowerPoint presentation that when the board or committee members go out and speak to the public, that can be used. Public speaking and media support. And part of the scope of work is to create a RFP for a larger scope of communication work in the year ahead.
And RFP, for folks who aren't familiar,
Yes,
just stands for request for proposals. So it's basically what we send out or post publicly to get contractors to apply for specific work with us. So that's basically how we got Patty to work with us, is we wrote a request for proposal and a scope of work for her. So, and I think one thing that the piece to me that's super important about all of these is that the strategic message guide is first. This is the piece we've been waiting for, is an expert in strategic communications who can help us to design all of these things in a way that is clear, and that there's, as we've talked about here many times, there's lots of ways we could say the same thing, and we want to do no harm in terms of creating confusion or anything like that. So I'm really, really excited and grateful for Patty and for this contract, because everything needs to, all of the other communications work needs to follow that strategic message guide. So that's why it's number one. And that's the piece that I at least have been really waiting for. So just wanted to call attention to that, the importance of that foundational piece here.
yes, thank you. I think we can move to the next slide. So here is the kind of timeline of the work and what's going to be worked on in the next couple of months. So we're working on finalizing this document that you're looking at. We, like Mimi said, the board is doing some work on draft mission statements that we will be bringing back to this group. The strategic messaging guide, I'm having a final draft in August. The frequently asked questions document, that PowerPoint presentation, and the one pager. And then if we want to move to the next slide, I think it has other, yes. Working on some of the website copy, since we getting some support on that, because at this point we haven't had that. And scheduling and conducting communications trainings with the board and committee members. And then if we want to scroll up a little bit, maybe, I don't know if we're beginning with the September to December. I meant down, sorry. Just to have it as the next section here. So in the September to December timeframe is when we are going to re-engage with Diana Bianco's work from Artemis Consulting, and we'll be collaborating with her again as we prepare to have a draft plan and have questions created to take out to those stakeholder groups that we Senate Bill 1089 directs us towards. And then assisting with the scope of the RFP, which we talked about. If you want to scroll up a little. You can maybe take that all the way to the top. Oh, I guess, is that maybe it? Okay, and then monitoring public and media response in that time period as we have a draft plan and we're out there more, as well as communication support for the legislative status report that is due to the legislature this fall. Is there another slide after that, Isabel? That's it? Okay. So we reached the end of the document. I don't know if people have any questions, comments, feedback that we can bring back to Patty when Michelle and I meet with her next week around this plan. Colin.
If this timeline was to continue past December, like through January and March, what or isn't that what's happening? And can you speak maybe to what would come next?
I mean, there will be more of a plan, but at this point, this is what we have engaged with Patty for this scope of work.
I think
Great.
Michelle, go ahead.
yeah, there's not a ton of additional funding, and frankly, for a lot more communications work. A lot of these pieces would continue, and Patty's contract is kind of time limited. So we would need somebody with a communications background to continue like the media monitoring and to help to incorporate the feedback that comes back from those engagement sessions that Artemis Consulting is going to help us do, so that we can take that feedback, summarize it, fold it into whatever draft plan, and then finally have some strategic communications support for the final plan that will go to the legislature in September of 2026. So there wouldn't be a lot of like brand new exciting communications things that we have the funding for. Frankly, our budget remained flat from last biennium to this biennium. Although, we are of course grateful that the legislature gave us full funding for this work. But it would be a continuation to see this through until we submit the final plan to the legislature, making sure that at every step it is, plain language and within our strategic framing. Does that answer your question, Colin?
Yeah, thanks.
However, remember this period, this September, December, we're going to re-engage with Diana Bianco. And so there'll be kind of a layered effect where this strategic communication work may be wrapping up with Patty, but Diana will be, in that period. I don't imagine that all of the group, kind of focus group pieces that Diana is going to be helping with those stakeholder groups that are in SB 1089 are going to happen before the end of the year. So it's going to be kind of layered, and that work will continue into 2025 or 6. I'm sorry, what year are we on? So this is just kind of the scope of Patty's piece of it, if that makes sense. Any other questions or comments? That was a good one. Oh, there's no other questions or comments. Should we move on? We had a stretch break, but I think that we don't need one at this point. Should we keep moving forward with the agenda? Okay.
I
So a
think at this
check-in.
point, this is when you're going to. I
The style
apologize.
guide.
Yeah, for the
Yeah.
no, I thought you were going to go over the strategic messaging guide, that second.
Oh, yes. Thank you. It wasn't
You're
listed on the
welcome.
agenda, so I missed it.
Apologies. So,
If you can bring
Isabel,
that up.
if you want, I will share my screen because I happen to have pulled this one up, if that is helpful, and we'll get going. So apologies, because this one doesn't have the front, but this is the strategic messaging guide. Is everyone able to see it adequately? Would you like me to make it a little bit bigger, or is it okay? All right.
Okay.
So I'm going to scroll, and you tell me when you help me drive, Amy.
Okay. Yeah, so this is again draft and just getting the first, input from you all on it as we continue to work with Patty. So the purpose is to have a message guide, to help us really clearly and consistently communicate about our work. And you'll see bolded here, the messages are designed to be clear and concise in order to increase understanding, trust, and engagement. You can move up. Yep, supports the 2025 work being done for transparent and inclusive process. So here are some of the key pieces, core messages. So kind of the elevator speech concept. It's the first piece. And then kind of if you have a little bit more time, what else to go into. Give people a minute to absorb this. And again, this is still draft. It should probably have draft stamped on it. Are people okay for us to move to the next section?
Thanks, Jocelyn. Got a thumb.
Okay, yeah, thank you. And then kind of still longer messages, or if people are asking specific questions, the what, why. Speaking to the different groups that we're focused on for this point in the work, small businesses, providers, households, families. You can, I think, scroll up. What comes next? And then other talking points. Which are some repeats of the others, but kind of depending on who you're talking to, sliced and diced a little bit differently. Medical debt, talking points. And then messages specifically for rural Oregon businesses and providers. Oregonians want action. And then what's next? And then here's some do's and don'ts. So do start with shared values for affordable, available healthcare we all deserve. Use everyday conversational language. Ground the issue in real people's lives. Repeat core messages consistently across platforms. And then the don'ts being, don't speculate on what the final plan details will be. Don't lead with complex policy details. Don't focus on what's broken without offering hope. Don't argue using data alone. People connect emotionally first, and don't amplify opponents' talking points by repeating them. And then start of a FAQ section like we've talked about.
One thing I'll note, which you're probably noticing now, is that this document is really grounded in the decisions the board has and has not made at this point. So one of the things we're trying really hard to be mindful of from the perspective of do no harm, and also don't create confusion at a time when there's so much confusing information about policy in general, is not getting ahead of any clear decisions the board has or has not made. So there is a lot to talk about with folks, but until we have more details of a plan, that is why we're waiting to do the engagement, because as you'll see here, there are a lot of things that we have to be really honest about the status of, which means that we have to say that that hasn't been decided yet. And that's why we're not going out and asking people to come and give us their time for us to just respond with, I don't know, to a lot of the questions that folks have, that are really important questions that'll impact all of our lives. So just wanted to name that, since I'm sure you'll be noticing that as you look at the FAQ.
So how much will it cost? How long would it take to set up a universal healthcare or universal healthcare in Oregon? And I think if there's other questions that you all hear as you're out there talking to people, that you're hearing kind of over and over certain questions, I think bringing those to us so that we can continue to build out those FAQs would be really helpful. And then this is a key milestones timeline. Oh, Jensina? See your
Yeah,
hand up?
I found the raise hand button. Are you proud of me?
Yeah.
One thing that I keep hearing is, how is the federal administration changing things? So our current president versus whoever is in office in 3 years.
Yes, that's a good one.
Could you say a little bit more about that, Jensina? Like, how would the federal administration, any changes to a federal administration, how would that impact the universal plan in Oregon? Is that what you're saying?
Yes, so of course it's not super clear that the Universal Health Plan in Oregon would be state-based, state-funded. And there is a lot of questions for folks who are currently on Medicare or Medicaid as far as what sort of coverage would be available to them under this plan, or if the current president is able to continue making all the cuts he has, or if we have another president who decides that they're going to undo all of the cuts of the current president.
Thanks, that's helpful. And I want to make sure staff noted that somewhere so we can make sure that we bring that back to Patty.
Thank
Um,
you, Isabel.
is there anything?
I was
Oh,
just
go ahead,
gonna add,
Mimi. Were you gonna say something?
Just yes, thank you so much for bringing up that point, because it's definitely coming across, certainly in the committee work as well. And kind of along the line of not wanting to do harm and but yet not just repeating, we don't know, is the fact that in the committee work, there is the way that it's being looked at is that different models are being created, sort of contingency planning. I don't know if that's the appropriate word to use, so I will let the wordsmithy people, but just for people on, people in this committee to know that that information is being taken in and is being thought of. And of course, it is very challenging to predict the future at this moment, but I'm so glad you brought that up, because I think that's a crucial question. So thank you so much.
Yeah, and it was good to hear you clarify it, just because there are multiple factors in terms of funding that the state gets currently, and as well as things like waivers that have to happen, federal waivers, to change how we currently do our healthcare in Oregon. So this is a high level timeline, so that can be easily referenced. And then I think we can, is there more?
Oh, this is the end of it, although I'm
This is
just
the end.
realizing it.
Okay.
December of 2026, that actually needs to be September of 2026 is when it's
Yes. Good catch. Yes, that's when our due date. Someone wanted to give us a little extra time there.
I know, I appreciate that, definitely. I'll stop sharing for right now.
Oh,
Are there-
team,
yeah.
sorry,
Yeah,
I
John.
can't find my raise hand button. I just wondered if there's time for a couple more.
Absolutely,
just,
absolutely.
bits of feedback on the messaging guide. And actually, I'm kind of, if you guys have, I mean, if you don't, I guess it's kind of speak now or forever hold your peace on kind of like sharing just a few things kind of upon reading. On the core messages of the strategic message guide, looking back at like core message 1, there's actually, does anybody still have that on screen that you could reshare? Like, because it might be more
Yes,
meaningful.
I will. Yes, John, I'll bring
Yeah,
that back up.
So it's like, I think
yeah,
page
under
2
core
of
messages.
yes,
Yeah,
top of
hang
page
on
2, I
just one.
think.
Got it.
Yeah.
Sorry, just give me a moment.
And so at the risk of being branded nitpicky, I'm pretty sure there's other people that'll come behind us that are not part of the committee, and they're going to be just probably more nitpicky. So I'm just going to sort of throw some things out there. So in that section 1 there, you know, we first paragraph under item 1 under core messages, which is the super condensed one. We say, hey, people should be able to get care. I'm paraphrasing here, paragraph 1, but Oregon's healthcare system isn't working. Costs are rising. We're spending more in healthcare than housing, delaying treatment, et cetera. Next paragraph, that's why the legislature created the Universal Health Plan Governance Score to design options to provide care for everyone. So this is super nitpicky, but if kind of I'm in an elevator speech and I'm kind of saying to folks, hey, costs are rising, households are spending more, people deserve deserve care no matter who they are or where they live or how much they earn. And then we come down and we say, oh, the first thing that we pivot to is we say that's why the legislature is doing this thing, so we can have a publicly funded universal health plan to provide care for everyone. So the thing that's just sort of tricky about this, and this is, I'm going to kind of do a callback to some of the earlier conversations we had like months ago about like, you know, I think we were brainstorming messaging. That was a really interesting meeting when we talked about some of the things that may or may not resonate. And I'm also reflecting on some of the things like Colin shared from some of his, you know, public information meetings that he had at that time. But basically what we're saying is the legislature did this thing so we could have a universal health plan, like a universality. I just happened to be kind of poking around at some recent OHA presentations, and it looks like, don't quote me on this, and I may be taking it out of context, but the degree of folks that don't have healthcare insurance in Oregon is actually pretty low now. So it's like we're kind of making that pivot in that super tight first message, but we're not saying sort of straight out, flat out, hey, look, this is we're doing this thing to make it things more affordable. We're not sort of turning around and hitting each of those points of pain. We have kind of pain points enumerated in that first paragraph under item 1, but then we're not coming back and sort of saying, actually, the effort isn't just about universality, which we're implying in that first sentence of the second paragraph. It's about affordability. It's about access. You know, like, I know, again, this is the super tight version, but if we're not addressing kind of the key points of concern that we're raising, and of course we're speculating because we don't know the plan design, but if the intent is to create both universality, yes, I think we can all agree on that. And I think honestly, Oregon is one of the better states with regard to already being there. And that kind of brings up a second concern that I think, I can't remember maybe who among our group brought this up very strongly, and I think we've heard it multiple times since, is there's a huge, huge concern about any average consumer, and sorry, I don't know what the right word might be, but average consumer in Oregon about if, you know, over 95% of folks have some form of health insurance. The concern is, you know, and I don't know if you guys have heard this framework before, but like there's this kind of behavioral economics principle that says the fear of loss is more motivating than the prospect of a gain. I'm probably butchering that phrase, right? So, but there's nothing here for the 95% that already have something. What does that mean for me? Will it mean what I might be imputing here, if I'm hearing this for the first time, is, oh, you know what? Universal healthcare, that might mean less choice. It might mean more narrow, you know, it might mean a loss of something that I value now. What about those things? I don't have an alternative suggestion. I'm just saying, to me, I think you have to go pretty far down beyond core message 1, down to maybe 3, 4, or 5. Sorry, I'm going to scroll down here. I'm going to have my own cheat sheet here on a separate screen. I think if you have a little more time, and then longer messages, like I think you have to go down to maybe like page 3 or 4 before you really get into messaging that kind of starts to touch on points of affordability, but I don't think so far, none of this speaks to the fear of loss. And Mimi, I can't remember if you were around for some of these, but some of the ones that really talking points we heard from attendees at prior meetings would really pounding the table about folks in unions, for example, who negotiate hard for what they have and they don't want to see that taken away. And so we don't address kind of like, we don't really hit the ultimate goal of this thing, which is to deliver something so that we're paying less out of pocket. I mean, that's the message, right? Like we want this to be less expensive. We want to see choice. Choice isn't brought up at all. Like we want to see the doctors. We want to see, this is old classic, public relations out of efforts like this across the country at the federal level, right? Like, there's nothing here that kind of hits those key concerns head on. And I mean, we can't presume what the governance board is going to do at the policy or the plan design level at this point. But if we don't address them, it seems a little mushy. If we don't address those issues of affordability or saying it straight out, this is going to be lower cost for you. We're making an earnest effort here so that healthcare is less expensive, less costly for households. It won't compromise your choice of dog. And again, I know we can't say this definitively, but it should at least hint in that direction that we're trying to preserve the things that we like and address the things that we don't like, to put it simply. Sorry, that was a little bit of a rant.
No, that was great. I think that's really helpful feedback, and we will definitely have Patty watch this recording so she can hear that directly. And yeah, I think that's really important feedback. Are there other? Colin?
Yeah, I like everything you just said, John. I don't know how to, I think it's smart to keep the core message to these two paragraphs, or to keep it so short. And also the comment on lowering cost for everybody and also increasing choice. And then this goes to the do's and don'ts about what we want the strategic messaging to be like. We don't want to speculate on this part of the plan design, but the task force of universal healthcare, my recollection is that they encourage the framework of this work to be, and something I've said is like, every provider in Oregon will be taking people that have this coverage. So every provider, hospital, clinic in Oregon will be available to every person in Oregon, like they'll be in the same network. So that would increase the choice for everyone and let all patients access higher quality care and choose the provider that's providing the best care, not just the one that happens to be connected to their insurance plan. So that's long-winded. I don't know how to throw that in and squeeze that into the second paragraph, but
hey, Colin, you reminded me of another thing, not to get in the weeds too much on demographics, but obviously our legislature is sensitive to voters and our the proportion of our population, for good or ill. This is just the fact that older voters vote at a higher proportion than younger voters. That's just, to put it simply. Many of those older voters have Medicare, Medicaid. So the question is, again, also how to do this in a really compact space. I definitely am not disagreeing about the need for compact phraseology and careful word choice, but some of those unions, if we think unions might be sensitive to this, imagine what is it people always joke about? I hate public healthcare. I hate the idea of public healthcare, but you'll have to pry my Medicare from my cold dead fingers or whatever. Like jokes about people who are older and criticize public health insurance, but they love their Medicare. So there's got to be some deft way of refashioning some of this language, I think, to without being so literal. I'm being very literal to convey this point during this meeting, but there has to be some artful way of refashioning this language so it kind of hits those points of concern. And it's not even concerns I'm raising, it's actually the things that the document raises those points of concern, but it doesn't I don't think it does a really complete job of doing addressing those things that Colin was just speaking about. And there's one other minor thing, you guys, and I'll stop my rant and say no more here, but there's multiple mentions about in 2023, Oregon households spent 21% of their budgets on healthcare and more than on housing. There's something about that, just, I don't know, that sticks out to me as something that doesn't like, I don't know, it's just, I don't know, rent or like, maybe that there was that much expenditure, maybe the expenditure was more than housing in terms of like wherever you get that 95% of Oregonians that have health insurance. It seems weird to me that anyone with health insurance, unless it was a really awful insurance, would average out to be like out of pocket 21%. It might be that there were 21% of their household, an amount of money equivalent to 20% of their household budget was spent on healthcare, but it doesn't seem like for most people that would jibe with reality. Like, I don't know about you guys, but I know I have good insurance. So granted, I'm speaking from a place of privilege here, but like, I'm just saying, even for the rest of the 95% of the people who have some form of health insurance, that would seem really far out to me, to be honest with you. Like, so I just want to be very careful because, people that are not, might be adversarial to this initiative could seize on those things and make hay with them if we're not 100% sure that that's exactly on point. So sorry, you guys, I don't mean to be adding fuel to criticism, adding fuel to the fire here, but.
No, I think it's important points everyone's raising. Jensina?
Yeah, actually, I wanted to present the other side of the coin from what John was just saying about 21% of their budgets on healthcare more than on housing. I don't know what kind of housing world other people live in, but I know housing is way more than 21% of my budget. And so honestly,
Yeah, exactly.
I think that I also have problems with that particular statement just on the opposite side of where John's coming from, I think.
Thanks for raising both of those questions. I know that we have a solid reference for any data that is in this document. And we could certainly send that out, and maybe there's a different way we can phrase it. But I think that it is shocking to most people. I mean, especially for anyone who has a family member who's had any kind of medical challenge. The amount that households are paying, even with insurance, on healthcare. I know from my personal experience, I have a partner who had cancer last year, and I can't even explain the cost. Even with decent insurance cover, from an employer, I can't even begin to tell you. And so I do think that there is it is shocking, and it's risen so quickly in the last few years, like the amount year over year that it's rising, that I do think that it's higher than we're used to thinking about it. And most of our communities have really high percentages of people who are cost burdened or severely cost burdened, paying more than 30 or more than 50% of their household budgets on housing. So I do think that these are all important points, and there's a way to both point to how alarming the rise in costs and the burden that it's placing on families, which I think is really important and really real, and that not everyone knows that, and also to acknowledge the realities around housing, because I think that could be, frustrating for folks. But anyway, we'll get you the reference, and I think that there's another way we can probably word this. So thanks for bringing these up, John and Jensina.
Yeah, that was really important. When I think, John, you brought up the union piece, and one thing that I've thought about is in terms of, like, say, a teachers union, is that they spend so much time in their negotiations on the healthcare piece, that if that was off the table, they could actually focus on things like smaller class sizes and safe working conditions, and like whatever field the union is in. They so like one thing may be that if that piece is off the table, you can actually dig into the real issues of what's happening in the workplace.
Even higher pay, right?
Yes. Yep. All those things. Yeah. Any other comments, questions? I think this is a really fruitful conversation, and I'm excited to have Patty listen and kind of dig in more, because again, this should have draft water stamped on it, and it is definitely a first draft. Craig, and then Colin.
Thank you. This is just, I want to just mention this, how all my life I've run across the same kind of roadblock. I'll be as brief as I can. When I worked for a company that didn't offer health insurance, the Affordable Care Act was proposed. I was shocked that my coworkers were unhappy in their present situation where they did not have health insurance. Now here's an alternative to make their lives better, yet they were resistant to it. And it just shocks me how we can overcome that. And let me just say one more thing. I have ice cream with somebody I've known since the 1980s. And she is a supervisor at a hospital here in Oregon. And just to give background, she's a conservative Republican and I'm a liberal Democrat. And of course, we somehow got on to, she mentioned that she reads this report daily of the patients at her hospital. And I don't recall the exact number. It was either 22 or 28% of those patients admitted at her hospital on a daily basis are on private health insurance. The other 72 or 78% are either Medicare or Medicaid. And she said they are losing money on the Medicare and the Medicaid patients and only making money on the private insurance. And she said, in the future, a lot of hospitals are going to go out of business. So we got on the Affordable Care Act, and I was trying to tell her, well, at least you're getting, wouldn't you rather have half a piece of pie than no pie? And what I'm just getting at is, obviously we didn't come to any agreement. I'm tired of the other side or citizens complaining about their plights. We are trying to offer them a solution out of their plight, and we get so much resistance. Anyway, I just wanted to share that. I'm sorry, I'm not really solving anything. It's just something that has frustrated me all my life. And I don't know. It's just shocking. It just seems like it's a huge metal door that's about 12 inches thick, and I'm pounding on it, and I can't get through to the people how we should at least try something, because everyone seems to be complaining on the left and on the right, and yet they're resistant to any change. Thank you for listening to me.
Thanks, Craig. Colin?
Yeah, I have a response to Craig, which I don't know if it's helpful, but when I'm feeling down, I think about it, which is like about an echo chamber, just like the visual of you slamming your hands against like a giant metal door. And I think about like screaming in an echo chamber, maybe if people are screaming in an echo chamber, eventually the echo gets loud enough that people outside the chamber can hear it. So like keep hitting that metal door that's 12 inches thick. I don't know, not a great metaphor, but something that I have held on to in the last couple of years. I wanted to comment on page 6, which is the do's and don'ts. And that first don't is speculating on what the final plan details will be. And I know like the realities of our communications timeline and the first draft of the plan, but I really hope that we can use these skills to be specific as we can when it's appropriate to do it. And I know that we're building we're sort of like building the framework for a house before we know exactly what size the house is going to be or something like that. So we're doing the best we can, but I hope, yeah, eventually we won't have to speculate on the first draft of the plan.
Don, I see your hand. Oh, you're on mute. You're on.
Sorry. One quick follow-up. So in other words, I didn't want to. The one thing I just did track down Amy, was the 21%. I see where it comes from. It's from a recent OHA kind of presentation on healthcare costs, and it's if I had if there was a chat feature, I'd just dump the link in there for you all to see. But basically, it does say that that figure includes employer and employee spending on premiums. So just to be clear, the 21%. The way it's at least the way kind of I think in normal, I mean, sorry, I don't want to say normal. The way that I read it personally was when I came across the 21% and saw it multiple listed, my reading of it was, oh, that's the outlay that the consumer or the plan members themselves are outlaying in terms of their own out-of-pocket expense. But the 21% figure cited by OHA is sourced from US Bureau of Economic Analysis, but it includes employer health insurance premiums, which I'm sure if you withdrew that, it wouldn't be 21%, it would be something else. So I just think it's good to be kind of to be kind of full disclosure about that, like, because it's hard to kind of understate. It's an enormous amount of money the employers are spending. Let's be honest, like there's probably a huge percentage of that 21% of healthcare expenditure per household is in part paid by the employers. Or as was mentioned just a minute ago, Medicare, Medicaid, I guess. So.
Thank you.
Sorry.
No need to be sorry. Any other comments or questions? I think this is, a really helpful and fruitful conversation.
And Amy, if I can just add, certainly this is absolutely not the only time. I know Amy said make sure that you have draft on it, and there are no nits too small to be picked. We absolutely want to hear from you, and any way you want to get the information to us, share with Amy or Michelle, or send an email to the general info email or mine or Isabel's or Lee's. Just the insights that you all have are so valuable that truly, just please keep them coming.
Yes, so after you walk away today, if you have more thoughts or insights, please do email before our next meeting.
Yeah, and Amy, we haven't talked about this explicitly, I don't think, but my expectation is that because the plan design committee and other committees are working on scenarios for how this plan might work, even after we incorporate all of your insights and thoughts from this conversation, I expect that this is going to be a living document and it's going to be updated as we move forward. So there's really no stopping point for if you have thoughts as we move forward that you'd like to put forward for this, at any point, please let us know. And I would expect that we'll be bringing it back to share with you all when major updates are made to it as we move forward and get more clarity on plan design and expenditures and those types of things. So like many aspects of our work, this is going to be ongoing, and I'm really grateful for all of your thought partnership.
Yes. Anything else before we move on from this topic? And I just want to check in. Do people feel like they need a break, or I don't anticipate the rest of the agenda being super lengthy, so I don't know if people want to just move forward and end sooner, or if people feel they need a break now.
I'm okay to move forward.
Okay, not hearing any calls for break. So up next, we are checking back in on the style guide, which I know you all did a lot of work on last month. And is there a slide, Isabel, for that, or Mimi?
Yeah, I'll just
There you go.
so what I wanted to say, so for today's committee meeting, this is not going to be that in-depth review again that you had done before. I'm so appreciative of all the people who have taken some time and have been able to send in their comments. Incredible. Shout out Nikki especially, but you all have done some great work. We didn't have the opportunity time-wise to get it translated to be available in Spanish as well. So we thought for this committee meeting that we would sort of table that in-depth review of those things. And what I did was not to call people out, but I again just thought I'd put up on here kind of these are some of the terms and the topics that are in the style guide and that people have mentioned that they would like to add some more information to. And so you can kind of just see here all of you wonderful people who have said that you would like to add some more information. And so we're collating that. And then I just, so this is those first set of topics. And then these are others. I believe, Amy, you were volunteered.
No, I had already volunteered myself. Yeah. Thank you.
I thought perhaps that you would as well. And as I mentioned, some of this we've received some great information already, and I want to defer to our chairs. But for maybe Amy and Michelle, you can kind of say what the plan is, how you might be working with Patty and the committee again to kind of complete this. So I'll just stop right.
And I think there were maybe some people, myself included, that still had additions to make. I see Colin shaking his head. So I don't know if we need to revisit, you know, a due date for that piece. Michelle, I'm kind of looking to you. I know we want to.
Yeah, I wonder if you and I as co-chairs can just touch base with the committee members that are listed here and figure out what that timeline looks like, what timeline might work for folks. Because I know some people are out for summer PTO or different things like that. So I don't want to set a deadline today that
that makes sense.
Doesn't work for everyone.
Okay, so we will follow up and check in, as well as when we meet with Patty next week, kind of come up with a plan and her involvement and version control and all of those things.
Right, that sounds great. Isabel, I'll turn the reins back over to you.
All right. So Colin, are you raising your hand about having an update or about the style guide? Either way, go ahead.
Thank you. No, it was just about the style guide. I feel compelled to comment that, I've personally complained about the governance board, delaying different things and, why don't we have a final draft, or excuse me, a first draft by this summer? And then that July 11th deadline for us to submit our comments to the style guide just screamed right by, for me personally, I think for a lot of us. So excited to contribute, and we'll find a timeline. So
thank you. Colin. Yeah, for that gracious and self-reflective comment. I also was somebody who took some PTO after the legislative session, which is a big part of my day job. And I also did not get all of my comments in by that deadline. So I will join you in owning my failure to deadline. And I'll share one of my favorite quotes from Douglas Adams, the author of The Hitchhiker's Guide to the Galaxy. He said, I love deadlines. I like that whooshing sound they make as they go past.
That's a good one. Okay, so I think next slide, we're going to follow up through email about the deadline for the style guide. And then do any committee members have any updates that they want to share of work or events that have passed or are coming up that are relevant to our committee? Mickey.
Hi there. I was wondering if I could just do one circle back to the style guide. I'm not sure if you received, but I sent a couple of documents and I didn't insert them in the existing template because I didn't want to add something that you might not want to add. So culturally and linguistically specific, RealD and SOGI. So there's a few things that I added as well. So just wanted to let you know that it's there and then some in case you wanted to use some of that. And it was like so much and I was like, oh my gosh, there's all these resources. So I actually tap the help of artificial intelligence as well. So that was really helpful. So full disclosure, that was with AI help. Thank you.
And thank you, Mickey. Yes, we absolutely got those. That's why you got the extra special shout out. We're very
Thank
grateful.
you.
Great. Just one more call for if anybody has any updates they want to share today. Colin.
Yeah, so I've mentioned before that Healthcare for All Oregon is trying to do community conversations where we're going out into whoever invites us, unions or schools or churches or wherever, and matching up speakers with our organization that can obviously give as much information as we can about the governance board and the committees, but with the perspective of our nonprofit that's interested in universal healthcare. And so I guess the thing to comment or just update is that our we have a new volunteer, sort of an intern, who's focused on that specifically, and the way that groups can reach out to us to request a conversation is by emailing speakers@hcao.org, and they'll be lined up in our speakers calendar and can line up groups to come to different places. So we'll advertise that obviously in our own circles, but that's yeah, I don't think anyone in the committee or the board will reach out to us. That seems like a little convoluted, but if anyone in the public is interested in that, speakers@hcao.org is a good way to get connected with our organization.
Thank you. Any other updates? Okay, next. What back one? Thank you. Yes, so just wanted to check in on reflections about what we've looked at today. If anybody had any thoughts from any of the topics, the style, or I mean the communications plan, or any of the things that we've looked at today that they want to reflect on that came up later. And future topics. Craig, yes.
Oh, I just wanted to say my brief reading as quick as I could when the screen was shared. I mean, I liked what I saw. I liked the way it was written. Rather in layman's terms. I appreciate that. Whoever has done that has done a good job. I approve of what I've seen so far. Thank you.
Yes, and just a reminder that all the materials that we share at the meetings are on the Universal Health Plan Governance Board website under committees, and then under our community engagement and communications committee for today's date. Like if you want to go and dig in more, and I know that we also get emails pointing us to the materials. So just if people want to dig in a little bit more and then send us follow-up emails. Any other reflections? And in terms of future meeting topics, Michelle and I will be meeting with Patty, and so we will be bringing updated versions of some of these documents, I'm sure, to you in our August and September meetings. I don't know if there's other topics that you all would like to see in our upcoming meetings that weren't addressed in the timeline that we shared with the communication plan. Colin?
Yeah, I am interested in continuing the conversation, which I recall from a few months ago, I think at a governance board meeting, about whatever combo, just if the governance board is going to do in-person meetings around the state, and if those are going to be supplemented or augmented with a partial communications committee thing, or and I know that that's going to be part of the transition after, like, the post Patty Bianca timeline in 2026. But yeah, I'm interested in that, if the governance board is going to go physically or partially virtually to locations around the state.
Yeah, thank you for bringing that back up. That was something that was discussed and then kind of put on pause as we had staffing changes. So that's something that we can look at again and figure out where that fits in the timing of the other engagement activities. Yeah, thank you, Colin. Any other topics? Okay, I think we may be ready for public comment now.
Yes. So as many of you know, we greatly appreciate members of the public taking time to provide input on the efforts of the committee and the board's work overall. Excuse me. Comments can be submitted at any time via the Universal Health Plan Governance Board website. And for written comments, we ask that people submit those 72 hours in advance of the meeting. And for spoken comments, we ask that people sign up at least 24 hours in advance. Comments are limited to 2 minutes, and we've got the timer on the screen. And once the timer winds down, we'll ask that people wrap up their comments. And if you go over time, we may need to interrupt you just to ensure that things keep moving. If there's any additional information folks would like to share, please feel free to send that via email to staff or to sign up for a comment in a future meeting. So with that said, today we have one person signed up for public comment, and that is Lou. So Lou, whenever you are ready, the floor is yours.
Can you see me?
Yes, we see you.
Okay. Nice presentation on kind of outline on how to begin with, you know, when you're talking to the public. However, I did like John's, you know, critique of it. I do want to stress that I really believe the committee should outline the organizations and groups and who's in charge of those groups and the people to outline those groups who that you want to talk with, that you want to present with, that you know, whether you're going to travel, whether it's going to be on Zoom. And for sure, I keep hearing that the groups that you are not talking to are unions and retirees. I think unions are very important to talk to. And number two, there are contradictions with some of the unions. Unions have trust funds that are nationwide or 2 or 3 states wide. And what happens when the public universal plan is taken out of those trust funds? You don't think they're going to be concerned about that? You should look into this. At 100%, you need the unions on board to get this thing passed. And just as a sideline, before I run out of time, I really don't like the word stakeholders. Stakeholders comes out of a business model. I don't know what you could replace it with, but it again, you know, your risk management, all those are words invented by the insurance companies. And with this, you know, you can talk about this as an insurance, but I'd like to see us get on a healthcare model, kind of speaking to it. Thank you for your work. Once again, it's a big job and I appreciate it.
Thank you, Lou. Is that the only public comment today, Isabel?
That's correct.
Okay. Well, I think with that, we can adjourn our meeting for July. Feel free to follow up to any of the topics we talked about today over email, and we will see you all in August.
Thanks, everyone.
Thank you. Thanks, everyone. Have a great summer month before we see you again.
Happy summer.